Welcome all. We'll get started in just a couple of minutes. Great, there's Mark. Great.
We'll try the
Okay, good morning, good afternoon, good evening, everyone. We're just going to give it about 2 more minutes for some people to join. As we're waiting for others to join, I'm going to send out a poll quickly. If you could just take a moment to fill that out. Actually, yeah, let's go ahead and launch this poll. Okay, great. Keep filling it out, folks. Thank you very much. It looks like we've got a lot of communications officers on the call. That's wonderful. Almost everyone is already using Facebook and Twitter. A few less with Instagram. That's great. Okay. We'll give the poll another maybe 30 seconds and then we'll go ahead and start. Okay. All right, hello everyone. I'm going to leave the poll on just for a little bit longer here in case we have a few more people join. But you can push that off to the side and we'll go ahead and start our call here. Thank you very much for joining us today. My name is Lacey Ahern with Global Partners in Care. And we are really pleased to be hosting this meeting with the African Palliative Care Association. We intentionally made this a meeting format and not so much a webinar so that we could have more interaction with you. We could ask questions, you can ask questions, and we can really kind of meet your needs during this. So please, this is meant to be an interactive meeting. And so we ask you to keep your microphone muted when you are not speaking, but to also feel free to raise your hand, put a question in the chat throughout the presentation. I will keep a moderating role here and I will pay attention to your questions and bring those to the attention of the speakers so that we can really address those in real time. This is meant to be helpful for you. It's also meant to be a sort of basic introduction to online communication. So you may find it's a bit easy or not for you, but we hope this is a good starting point. And then we hope to be able to offer additional meetings and support in this way. So thank you very much for joining. And with that, I will invite Wezerai from the African Palliative Care Association, who is going to kick us off by talking about really the importance of having a strong online presence and what that looks like in context. All right, thank you.
Okay, hello everyone. Good morning, good afternoon, good day, wherever you are. Just get my video on just a second. Okay, so yeah, welcome once again. I'm just excited to have this session. And I'm going to share briefly because my presentation is literally just looking at the very introductory bit about why we thought we should have this webinar. Obviously from interactions with our partners at national level and their members also at that level. Okay, so increasingly we are seeing online platforms emerging as a very important media of communication globally. Obviously because of their ability to reach a huge audience at the same time, there's a huge potential to reach people without making too much in a very cost-effective way. Also, because we are in the not-for-profit sector, we find that most of our funds are directed towards our programs and our services, and so we don't necessarily have huge communications budgets where we can put adverts out there and so on. So being online is a very valuable tool for us in the non-profit sector as compared to people in the private sector who might have huge marketing and promotional budgets. Then we have seen increasingly now that our sector is using online platforms to spread messages, you know, for their cause, whatever, whether it's a specific project or whether it's their overall goals and aims. And it enables us to tell our stories to people of interest. You know, the people that I see online, we have quite a number of associations that are quite active online. And you can see that from their being active online, they are attracting a lot of comments, a lot of interest, a lot of engagement with new and old people. So these are just a few pointers of why it is important. We can reach out to like-minded entities, potential advocates, potential donors, etc. And have conversations that can deepen our learning, deepen our experiences with like-minded organizations, but also not only the like-minded, we can also get to convert people that are not interested in our cause to become interested in our cause. So that's an important role for being online. We get to meet people who are not following us, who are not interested in what we're doing. They can become followers and fans. Every post and image that we put online is a chance for someone to react. And this is whether it's old people, old acquaintances, or new people that are seeing our organization or our work for the first time. So every opportunity, every comment that we put online, it's an opportunity. Someone will react, someone will take an interest, and we can get somewhere. And who knows where a reaction can lead to. It can lead to an interest, a site visit, maybe a partnership, maybe reorientation of your programs if you think that those comments are worth the while. Then we have lately the discovering feature where they use algorithms that follow whatever we search for, whatever we comment on, whatever we like, and they use those to generate similar content so that we have a better user experience. So someone who doesn't know about our organization, but they've been looking at hospice and palliative care services, our organization might actually pop up in their search because of the discovering feature that we are seeing increasingly online. It's a little bit, I find it personally a little bit freaky actually, because if I look at one exercise video, I find a million exercise videos following me. it's a little bit like Big Brother is watching you, but in the end, it can add value to what we are doing. So the options are many. I don't want to belabor anyone on these ones. I think Cindy will cover some of these in her presentation. But a recent survey showed of 9,000 not-for-profits showed that Facebook is the go-to for most non-profit organizations. It's their primary online platform, and we want to think about that also. Maybe just to put it out there that with most of us who are already active online and who are already doing interacting on these platforms, we just want to think of how much more impact, let's say, for example, the National Association, how much more visibility we would have if all our members had the same level of online presence as we have ourselves as national associations. If you think of, if I look at how the online presence of KEPCA and PICAO and HOSPAS, you know, if our members at their districts and at their province and at their regional levels could also have a similar level of interaction online, the visibility of palliative care would be, you know, I'm not sure how many times more, but it would be so much more, significantly so much more than that. So the choice of what you pick, and I think it will be covered, it will also depend on who you are targeting. What are your goals and what is your audience, and what action do you want them to take? But really, at the moment, and we can say this also even for Africa, that Facebook remains sort of like the NPO's go-to place. There's huge interaction on Twitter as well and so on, but this one remains the top. And there's just an interesting one here related to fundraising, which could be one of the key reasons why we might want to be online, is that 39.5% of people discover non-profits that they donate to on Facebook. I thought that was very interesting. That's almost 2/5 of people who are moved to donate something on Facebook. So even though these channels started off being just social interaction and, you know, family and friends chatting, but here we are, almost 2/5 of donations are coming through just Facebook, let alone the others that I am not necessarily talking about. Unfortunately, in today's world, people are reading less and less. So we might write very good annual reports, we might do very good, you know, project reports and so on, project documents, but people are reading less and less in our world, particularly the generations that are coming up now. So nonprofits need a robust digital communication strategy. We need to go digital, we need to go online, we need to reach people where they are sitting. They don't need to walk somewhere to go and get our content. Another interesting statistic is that 30% of online activity is watching video. So that also kind of makes us think about what kind of content we need to be thinking of and to be creating, and also to be thinking of our constituents. I mean, I think we may be very good practices ourselves, but also think of our members down the road who also need to be doing this, whom we need to be hand-holding and to be supporting to do this. And also mobile-friendly websites have become critical. A lot of people are not sitting in front of the PC most of the time. People are doing a lot of their work on the go, and we need to be mobile-friendly. So this is just a summary of internet users in Africa versus the rest of the world. And it's 11.5%. And the rest of the world is 88.5%. And this is against a background that our population is about 16.6%, almost 17%. I believe by now it might be about 17%, because Africa's population, as you can see from those two graphs, is growing much faster than the other parts of the world. So having said that, it means that our people are increasingly online. And this is probably my last slide. that just shows, if you look at the total population of Africa, just a bit above 1.3 billion. And if you look at our internet users at the beginning of the century, at the turn of the century, we had just 4 million users. But this year, we've got more than 500 million users. And so that's about 39% of our population. I'd like to think if this was done in March this year, probably by now we are talking 40% of the African population is on the internet. And so, you know, if you are thinking of how to reach people, you better be thinking of going online. And if we're thinking of meetings and conferences and events and so on, we also need to actually be thinking of more and more going online. This was less so. I mean, this stats came out before the impact of the COVID-19 epidemic. I would like to imagine that now, after COVID, this must be so much more. I think there's been some significant shifts, because many of us found ourselves shifting to online and having to develop an online culture that may not have been in existence before. And maybe the last figure I want to look at is this one in yellow. 212 million people on Facebook in Africa. 212 million. So even if in our work in hospice and palliative care services and our messaging and our targeting, if we wanted to reach just maybe just 10% of that, that's already a whopping 20 million people. But when we look at our stats and our reach at the moment, you know, it may leave quite a huge gap that's remaining. So people are on Facebook, but are we reaching them? And our members and our constituents reaching the right audience? So this is just as a prompt to say why we need to be online, and the potential that is there that we could reach just, I mean, I just used 10%, but who knows, we could reach 20, 30%. That would be a significant number of people, especially if some of them happen to be influencers and people who have huge followings. Then we can actually do a lot more than what we are doing if we focus on going online and making sure that our members are also getting online. I think that's my last presentation. Thanks very much. Let me just hand back to you again, Lacey. Thank you. You are still muted, Lacey.
Thank you. Thank you very much. That was very insightful. Cindy, I'm going to turn it right over to you. I don't see any questions immediately in the chat, so let's just continue with your presentation for the moment.
Hello.
Hello, everyone. Just a moment here while I get a brief presentation up. I'm going to be talking about audience tools to help you define your audience. I'm going to be talking a little bit about how to make your messaging more effective, because as Wezrai said, you know, being online and reaching constituents, some of whom you may already know, others you may not know, is very, very important. And we want to make sure that we're giving you the tools that you need to be more successful with this. So can everyone see my screen now?
Yes, we can.
Wonderful. So let's start with assessing the audience. Who is the audience that we're talking to as palliative care providers, as palliative care organizations? There's 4 questions that are going to help you understand your audience, which then will help you create the content that will be effective in transmitting your messages to them. So the first one is considering their education level. And this may not be general education. This may also include how educated are they about palliative care. When we're talking among ourselves, we speak a common language about palliative care. some of the people that you will want to influence, that you will want to educate about palliative care, don't speak that language yet. So we want to be very thoughtful about how we approach the topic and what kind of information that we're putting out. That doesn't mean that every post or every tweet has to be elementary. That's not the case. We just want to make sure that we are including in our messages some messaging that will reach and speak to a very novice level audience. And you also want to consider, what do they know already about your organization? Sometimes they know a lot, sometimes they may know nothing about your organization. So it's always good to mix in some information about who your organization is, when you started, what's your mission, and so on. The next thing that you're going to want to understand and think about here is, why are they reading your content? And so sometimes this will help to make, to divide your audience into three different, organize them into three different categories. Your primary audience is who you're writing to with that message. And in some cases, it may not be the general public. Sometimes you may be posting a Facebook post or a tweet to, maybe it's thanking your employees for the great job that they're doing. Maybe it's talking to your membership about an event that's coming up. Maybe it's somewhat directed at your national health organization to help build awareness and sensitize. So your primary audience for different tweets or different posts may vary depending on who you're trying to reach with the message. Your secondary audience is who you want to be aware of what you're doing, but they may not act on it. They may not have a takeaway that you want them to do immediately, but you want them to be aware of what you're doing. An example there would be maybe you're trying to build awareness in your community about a new service, but you also want the Ministry of Health to know that that's what you're doing. And maybe they do, but you would like them to know that you are publicizing this on social media. Your tertiary audience is pretty much everybody else. It could be anybody who just happens to come across your post on Twitter, on Facebook, on Instagram. And they may be intrigued enough to go check out your page. They may want to follow you. They may want to visit your website. So they would be the people that are kind of out there on the outer circle that you may be impacting. The next thing that you want to consider are, what are their attitudes and expectations? What are their attitudes towards your organization? What are their attitudes right now about hospice and palliative care? I think most of common knowledge right now about hospice and palliative care is not enough people know about it, not enough people understand it, and many people are somewhat afraid of talking about any kind of palliative care because it's bringing up subjects that are very difficult to talk about. So you want to be aware of that when you are creating your content. Also, what would they expect from your content? Would they expect to be entertained? There's some great videos out there right now that are entertaining, and they can be educational as well. It doesn't have to be just one thing. It can be multiple. You can have multiple purposes with your content. You can create awareness, you can educate, you can advocate for action. All of those are things that you'll want to take into account when you're creating the content. Next is, how are your readers going to be using your content? As Wizerai mentioned, many people now are accessing content on a mobile device. And so you have to take that into account. It's much different when you have a larger screen to display content on. You'll also want to make sure, particularly for websites, and I see a number of you would like to improve or learn more about website development. And in that case, you want to make sure that your website is optimized for mobile viewing. And there's a lot of technical work that goes into that. It's beyond what we would talk about today. But we do have some resources that could help with that. But that is a very, very important aspect to consider in improving or developing your website. How closely are they going to read your post? I hate to say that as much effort and thought as we put into creating content, many people will just take a look at it and scroll past it. So you want to be able to capture their attention quickly and effectively. The other thing is, what do you expect them to learn from your content? And again, a lot of that is going to be depending on who your audience is. So when you're developing content, here are some things that you probably already know instinctively, but we would want to keep in mind. So it's important to remember that humans are created to tell and remember stories. That is how that's how we share. That's how we're wired as people. So stories are very, very effective in communicating information to people. Some of the most impactful stories are actually pictures. We are visual creatures. We get a lot of information very quickly out of pictures. Social media does well now with pictures and videos. It's also designed for what I would call micro stories. You don't have a lot of time to develop a whole long, lengthy conversation about a topic. Now, what you can do is break it into very short little stories if you'd like to talk about a bigger, more involved topic. But it's really designed to capture people's attention quickly. 10 seconds is about as much information as you're going to be able to convey. Patient stories are very powerful, but there's some things that we always want to remember when we're sharing patient stories. We want to respect their privacy and dignity. We always need to get permission if there's anything about their story or their images that could be personally identified. And we want to practice the same care and compassion that we practice in our palliative care work as we do in the storytelling about that work. Other powerful stories are about how your staff or your members provide care. Those can be very, very compelling. And it's very good to use data to support what you're telling, but focusing on data in many cases does not attract attention. People look at big numbers and go, this requires too much thinking, and they scroll past. So scheduling and templates. One of the things that I like to recommend, and we've found it useful here, is to plan about a month's worth of content in advance. You're probably, it looks like everybody's already out there posting. And so this is something that you can work into your current social media practices. Is some posts can be repeated once or twice in the same month because repetition is how people learn. And so if you're sharing a post about your services, particularly a new service, if you share that 2 or 3 times a month, somebody may see it all 3 times, and then they will probably remember it. But you may also only catch some people once or twice with that post. So it's okay to keep sharing the same things, just as long as it doesn't become very repetitive. Some of the other things that we found are that lunchtime and the end of the day are times that you'll typically get a lot of views. So if you have something important to post that when people are on their devices. Unless your audience is accessing social media during the workday, if you're talking to other people in a communications area that you know are going to be on social media, doing things in the morning workday and the afternoon workday, you may not get as many views on that. Weekends are also good times to post as well. So what I'd like to do next is share a template that we have used that I think is helpful in being able to pull some of the things that we've been talking about together today. And so what this is, and I'll expand it out here. is an Excel spreadsheet that can help you further refine and define what you're doing on social media. So I'm showing you the one that we've done for Global Partners in Care. And we put this together very soon after we took over Global Partners in Care from NHPCO. And so we looked at who were 3 of our target audiences, and we spelled that out. We also looked at different messages, and this may change as your organization's work changes, or as, for example, a pandemic starts and you have to change some of what your messaging is. But you can define your messages by who you're trying to segment to. And again, that could be government, it could be ministries of health, it could be end users, it could be all kinds of different ways that you want to define your messaging. How are you going to target that? Are you going to use a combination of different platforms? How are you going to position palliative care, for example, as compared to basic curative care? And then the USP is your unique selling proposition. And that is what makes your organization different than any other organization out there. The area that you may want to look at right now most as you're trying to build a very comprehensive, cohesive social media outreach is looking at all the different content types. These are the channels that you can look at. And then build out what your objectives are in being active on each of these platforms. We've given some structure about what you can look at, what might be effective in each one of those platforms, how frequently you'd like to be engaging in this, what the tone of your content will be, whether it's very formal as in a white paper, or if it's friendly but professional on Facebook. And then you look at the desired action. What do you want to happen from what you're doing on that social media platform? So for example, I've got 3 social media platforms laid out right here with Facebook. The idea is to socialize, create awareness, build relationships, 100 to 250 characters. Some of those can be longer. 3 to 5 posts a week. We want to be friendly but professional, and we're trying to get engagement and involvement. You may actually at some point go into academic papers and look at that and then share that out on social media. That's a very sophisticated, advanced interaction tool, and not for everybody, but we've tried to look at how many different ways can you approach educating, building awareness, making sure that people are aware of your services, your stories, and what you do, and so that they can be more engaged in your work. This is also a tool that you could use if you'd like, and we'll be sharing this with everyone, that lets you build this content out per month, and it can be customized. You can, maybe you don't use LinkedIn, maybe you use Instagram. One of the things that I also recommend is that some things are made more for Facebook or Instagram than they are perhaps for Twitter. If it's a longer story or it needs a lot of explanation, Facebook would probably be the best place to share that. If it's a video or a very engaging photograph, Instagram is a great place to share that. You may want to show some of it on Twitter and maybe even push people from your Twitter account to your Instagram account. You can amplify your messages that way. And finally, one of the most important things that I think we as a palliative care fraternity do well already, but we can always do better, is to help share and amplify messages with each other. So of course that would be retweeting, sharing, making sure that we're using common hashtags, making sure that we are tagging and adding others in our fraternity, because that helps amplify what we're doing. It helps us reach more people, and it also helps influence the algorithms that are at the background of each of these platforms, because the more you see a hashtag, the more the platform sees the hashtag, the higher importance it gives that. So that is my kind of basic introduction here with some of the tools and tricks and things that we're doing. And certainly I'm always available via email. If anybody would like to talk a little bit more about this or has in-depth questions that I can help with, I'm always happy to help. So thank you for your time today. I appreciate it.
Thanks so much, Cindy. Thank you for that presentation. I think a lot of that content we would want to go deeper with it in subsequent sessions, so that if there's some skill building and so on, we can also do the same.
Great.
That would be actually, it would help. I think there are a couple of things you touched there that we might want to follow through.
Wonderful.
We are going to have a short discussion session after the next two presenters. I'm going to ask to invite Eunice from the Hospice and Palliative Care Association of Zimbabwe. And immediately after her, I'll also invite Zaitun from the Palliative Care Association of Uganda. In that order, they will just share, they will give some remarks and share their experience about being online, touch about the joys and the challenges, and also maybe talk a little bit if it is within their presentations about the challenges of getting everybody else online. So yeah, the challenges and joys of it. Over to you, Eunice. And Zaitun, you can follow shortly after Eunice.
Okay, where's my... Hello, can you hear me? Hello, everyone.
Yes, we can hear you.
Okay, I'm not putting the video. I think it was echoing. That's why I'm not putting. Good afternoon and good evening, everyone. I'm Eunice from Hospice and Palliative Care Association of Zimbabwe. I'm going to be sharing some experiences from here. So my presentation will just be hospice in brief, then our experience on the online platform, and then of course the challenges when we look in Zimbabwe. So really in brief, hospice is an umbrella body for palliative care organizations, and also that we promote palliative care and support palliative care providers in Zimbabwe. This we do through training and support. We also want to do what works, we find what works, and then make sure that our partners can then replicate. We mentor people, we also develop IEC materials, we set and recommend and monitor standards of care in terms of palliative care. Of course, there's a lot of advocacy that goes around in terms of really currently integrating palliative care in the national health system, where we are working with the Island Hospice, the Ministry of Health, and ourselves, and of course the wider community in terms of integrating palliative care. So we also monitor, evaluate, and do a lot of reporting on our programs, a lot of reporting on our palliative care activities. And all this really we do to promote a comprehensive approach to quality care, from diagnosis of a life-threatening illness to dealing with grief and loss. And of course, really relief of pain and suffering is very paramount. Now coming to the online in brief, really. Hospice has got about 100 palliative care organizations, members throughout Zimbabwe, and we do have a member in each of the districts. We have 65 districts in Zimbabwe, and of course 10 provinces. And in each of those districts, there is a member. And in terms of online, since inception in 2003, Hospice is very active at national, regional, and international levels. And more recently, with advent of technology and affordable internet access, Hospice has managed to spread its presence online using various platforms. And we have also learned, we didn't start by where we are now, we had to test the ground also, and learning from others, and also getting some confidence in what we are doing. So we are on social media, Twitter, Facebook, Instagram, website, and so on. So WSPAS has also grown in terms of using the online platforms, in terms of sharing our information and also sharing with other palliative care providers world over. Our online, we found that as we use online platforms, there is a lot of benefits on that. There's a lot of benefits. So for us, we will get to a larger audience in no time. Definitely we find if we put something on Twitter, within minutes you can see that people from all over the world are responding to that. So for us, really, it's also getting to a larger audience when we use online platforms. So going public with the organization's profile has helped WSPAS reach a larger audience. And our partners and stakeholders are located across the country. And of course, we also have others who are located elsewhere. Like now, our APCA and other associations world over, we are also members, and we share information through that. And of course, the accessibility. Palliative care clients and stakeholders frequently interact with WSPAS on social media. And at times people refer the patients and families through our social platforms. And so it has helped us to have been able to provide vital responses for services within a shorter framework also. And also really receiving valuable stakeholder feedback. That way we see that it does work when we use online platforms. It has also created legitimacy and trust. I know one time we applied for a grant, and then the donor then came back and said, no, WSPAS is not well versed in providing palliative care for orphans and vulnerable children because it's not there on their website. And that's when, that's a couple of years ago, about 6-7 years ago. So that's when we then learned that we need to keep on updating even our websites also. To keep on updating, as Cynthia was saying, we need to keep on so that people are aware of what we are doing. So we then had to do that. So again, WSPAS has been able to cultivate a culture of trust with current and also prospective donors. And also, because on our websites and whenever we share online, we highlight our milestones and plans for the future interventions. And so this, again, gives donors and our beneficiaries some actions for transparency. Affordable advertising and advocacy. Yes, of course, we know there is some minimal cost to it, but however, even though there is a cost to maintaining the organization's website, WSPAS has been using on the online or on the free advertising opportunities on Facebook and Twitter for job opportunities and many others, and even our own training packages and other activities and events which we want to share with the wider audience. We have often seen that we do advertising and advocacy through the social platforms. However, in Zimbabwe, there is some challenges which we face, and especially with other organizations. We are a member organization, but we have big organizations who are our members, and we also have the grassroots. We have also smaller organizations who are in communities who haven't grown to be able to package or to be able to use online very efficiently and effectively. And therefore, high costs of internet packages. I know when we wanted to do our AGM this year, we thought we would go the virtual way like anybody else. So we had to have a survey on our members on what they thought. And I can assure you, less than half of them were comfortable with internet to go virtual on our AGM. And why? Because they then had to tell us about the challenges which they thought were going to face. So again, many palliative care organizations have been affected by the economy in Zimbabwe. And therefore, the constant upward review of internet packages have left our implementers actually with very limited quality broadband subscriptions, which help maintain an online presence. And that's a challenge in Zimbabwe, especially with the smaller CBOs in our communities. We do have poor network infrastructure. I would want to say, even though Zimbabwe has made great strides in internet coverage across the country, those in peri-urban and rural areas have been left out. And therefore, implementers in those areas have limited access to online to online chances of actually getting to be able to use online when they are in the rural areas. And of course, the poor sound. When we started this meeting, and I remember Wezerai and Leslie saying, we can't hear you, we can't hear you. And I'm talking about us in the towns and so on. So you can imagine, so many times we don't hear each other if there is poor sound quality also. And this is a challenge here in Zimbabwe. And the electricity challenges, the power cuts. I know one day last week we were out in the field, and one of our officers needed to be online with another organization. There was a meeting, and suddenly the power cut went off, and the internet for the hotel where she was staying also was cut off. She had to quickly use her phone to join the meeting, to rejoin the meeting. So these are some of the challenges which people can now and again face when they are using the social media platforms. And cybersecurity. Certain organizations, I've heard people saying you do not have sufficient policies and procedures to guard against that. And therefore, the fear of them having to share their pages and also their work might be misrepresented holds them back to using the platforms fully, online platforms. But I'm sure as we have started this group to be talking like this, I think we need to be encouraging each other, training each other, making awareness that really online platforms do work and they have lots of benefits. I know staff and equipment resources. Some will say if you are in a workshop and you want to tweet on what the event you are doing and you don't have a good camera resolution to take a photo. At times you can just tweet without a photo, but it makes such a difference if there's a good photo that goes with it and so on. And I know as we always also share with other providers of palliative care and retweet and also sending the message again and again, you see that one message that is a good photo, it talks on its own without even reading the text that is there. So again, that it also computers, at times using our phones, but also it goes with the resources and it goes with the staff that are there to be able to. I know with us OSPAs, we have a post for documentation full-time officer, but when that post is not filled, we actually fill it. We actually feel it's like we are dead because we are not constantly posting, constantly updating, constantly talking to others outside the organization using our online platforms. And when that person is there who has the responsibility to continuously engage, then we will find there is a lot of difference. However, having said that, I think the online presence is the way to go. And we can see even taking lessons from COVID-19 environment. We were quickly forced we quickly adapted to online way of doing things. Now there's telemedicine. So we need to be sharing and also encouraging people to come out. I know many people are not comfortable yet. But I think we need people to, as we are sharing now, to encourage people to come out of their shells and just join the world as we do on online communications and use of platforms and so on. I think once people do that, then people are very comfortable too. I know even myself, when I started to say tweet, and I say, how would I do that? But so many times I say to staff, you see, I've done it before you. It's because now we are used to sharing information using the online. And therefore, I would want to say, Abuka, you've come with this and the other teams behind in terms of training, support, and creating awareness. This is very key. I know when they started, she was saying, do you think people would want to engage? They would want to, because there are so many people who are not aware that using online platforms actually works wonders. And so I think I would just want to say, as I finish, to say thank you so much for bringing us together and sharing also experiences and learning as we are doing. I learned a lot from what Cindy was saying and also everyone else. So I think it's good as we come together and learn. Otherwise, thank you so much. That's our sharing from Hosters. And over to you, Weze or Leslie.
Thanks very much, Eunice. Thanks for those remarks on the experience of hospice. Let me quickly hand over to Zaitun so that she can also share from their experience at the Palliative Care Association of Uganda.
Okay, thank you so much.
If you can stop sharing your screen, Eunice.
Yes, thank you. Let me do that.
Yes, good afternoon, everyone, and good morning to the team that is not this side. My name is Zaitun, and I work with the Palliative Care Association of Uganda. And today, as I would like, first of all, to thank the previous presenters for the great presentations. And you'll find that most of the things, of course, do not really differ. And of course, as Cindy was sharing, that one we've had like a series of discussions on how best we can improve our presence online and everything. So Cindy and the team, we thank you for you put a stone really on where we are today. So the Palliative Care Association of Uganda, we are a national association that coordinates palliative care services in the country. And we are a membership-based organization. Currently, we have a number of organizations that are part of us and a number of individuals that are under our membership base. Our vision is palliative care for all in need in Uganda. And our mission is to accelerate the integration of palliative care in the Ugandan healthcare system, of course, through capacity building, advocacy, research, and resource mobilization. And these are basically our major and core focus areas when it comes to the implementation of palliative care in the country. So this is basically the brief about PICAO. And like I was mentioning, we are a membership organization, and we currently have 24, though here it indicates 23, but we currently have 24 member organizations. And of course, we have the individual members increased from this number to 1,200. We have 10 regional committees. These are branches that help us coordinate the work we do within the districts. We have 14 full-time staff and of course volunteers. And our major thing basically is to, of course, call upon different people to join us as members of the association. So today's webinar, I was requested to talk about the value of being online, and of course, as we share our experience. As we all know, the COVID-19 pandemic came and it caught all of us by surprise. And we really had to adjust to see how best we can keep serving the different people that we serve, and also keep the coordination role of PICAO. So somehow this was an opportunity to adjust for PICAO and see how best we could communicate with the different people that we have within our fraternity. So given the restrictions, of course, I'll start from how we continued to work even if we were not working the normal way we used to work. We just had to devise means and see how we could continue coordinating the different hospices and palliative care organizations. And in this, we have used different online platforms to interact with the different kinds of audiences that we have an association. And we've kept them engaged, and it has somehow helped us grow our base even within the COVID-19 pandemic. So one of the things is that we have really kept on engaged with the existing community and kept everyone up to date with the work. through the different online platforms that we use, as you will see going forward. It has connected us to the world. Like when the different online platforms have connected us to the world, the different things we didn't know we could do before, we have been able to do and have reached out to the different people far from Uganda. Of course, it has also helped us in the planning of events and of course, attraction of different attendees, because you find that for events, you could organize and maybe have an engagement with the different people within Uganda. You will find that right now we've managed to go away from just focusing on the people within the country and reached out to the different people because of the online platforms posting different information. Of course, it has attracted growth of the network, especially when it comes to partners. And a case in point is the different webinars that we were having throughout the pandemic. You find that there are some topics we could bring on board, and as PICAO and our fraternity, we could not handle. So we had to source out for which people can we bring on board to help us talk to the audience about this particular thing. And from this, we just built a partnership and it went really far, and we are still in touch with the different people that we brought on board. Of course, online has helped us tell our stories, and like from the different engagements we've had, we've been able to share stories, because you can see that when we go back to the traditional media, like they said, we usually depend more on the printings. We print the different things, but now that you have no one to give these, how do you then pass on the information? And somehow we've been able to tell the stories through the videos. We've done the different posts we do on the different online platforms, and of course the photos, which end up telling a lot as opposed to someone just reading a statement. And of course, the online base has helped us to reach a wider audience, and it made it easier for supporters to get involved. So I think this goes back to the issue of fundraising that Wezerai was talking about, because the more you reach out to people with a cause, the more they come on board to come in and support your purpose that you're looking at. So that's how best the online platforms have helped us. And some of the platforms that we've been engaged on are Zoom. And as soon as this came out, we had to see how best do we now keep in touch. We had to reach out to people online, like via Zoom, keep on with the different things that we were doing, like the update meetings, like the different webinars, to keep in touch with the hospices and palliative care organizations, to make sure that the services keep on going in the different districts, and of course the different engagements we had on Zoom. We also had have group emails, and basically here we use the MailChimp, where we have like a whole group of people, especially the PICAO members and partners. So if we wish to communicate something, we just go through that email. You find that it gives you a platform to do whatever you feel like it gives you a lot of functionalities to pass on any communication that you wish to pass out. And of course, the other is the PICAO website. Of course, posting information on the website for people to come through and see what is happening, and of course leave comments, and we keep on tracking these through the analytics. We always go back and see which people have visited and which pages have they really been up to and all that. We also use Facebook, we use Twitter, we use WhatsApp, and for WhatsApp we have a group which brings together the different members of the association and our partners. So whatever information we have, we keep on posting this and all that. And of course, LinkedIn, and LinkedIn is more of a professional site that you will find. It's not, when it comes to the interactions that are usually like Facebook and it will not be that that much impactful. There is a particular audience that you have to target when it comes to that, and the information, of course, that goes there is different. And of course, the other platform is YouTube, which has really helped us when it comes to the videos. We've had a lot of different videos done, like we did the profilings for hospices and different palliative care organizations. And if we didn't have these platforms to post them, then we wouldn't be able to reach out to the different people to see the work that is really ongoing and what is happening. And of course, this one takes us to why some of the organizations or hospices have not been able to engage online. And of course, we have challenges as an association when it comes to the online platforms, and they will really not differ so much from what hospice shared, because you'll find that they are almost the same. It goes back to the cyber security. It goes back uh, to the people, like looking out for the right audience really to target. And of course, the other issue is about the content creation, the right content to create to suit the particular audience that you're looking at targeting. And so going back to why some of the people have not engaged online, especially hospices, because there are some that are doing real great work, but their work is not out there. It goes back to the lack of resources, and this comes to human resource, the equipment, the data. To some, it's really too much. They don't have a particular person who can really handle this. They don't have the right equipment to put out this information and things of a sort. And some of them lack where to start from. Like someone may be there and they're like, okay, we may be interested in starting up the social media platforms and all that, but where do we start from? They lack the technical knowledge of starting this up. And of course, some don't see the reason or value as to why they need to be online. Some think it's kind of a wastage of time. Some of them think it's there are particular people who should really be a part of online and social media and all that. So, and some have set up the profiles, but they have poor connections, and at times they don't, maybe they lose out the time to update information on their different platforms. And of course, the other issue is not engaging followers, and still this goes back to the setting of profiles. They some set profiles and leave them there for ages. So if someone comes and really follows and you're not keeping them engaged, it will put them off, and in the end, the hospice ends up really losing out and not getting the leverage that they wanted to get. So as I conclude, basically, as I know some of us are just starting up to see how best we can utilize the online presence. It's like we just need to remember why we are doing that, and remember why we are starting up the online platforms. And of course, we just need to keep trying, because I know sometimes things may turn out, you may post something and think it's going to get, like, let me say 100 likes, and that's your target. And going back the next day, you find you posted something or tweeted something, and there isn't like any like. You're like, I'm not posting again. So we just have to keep trying, and slowly we'll really see how best we can build our platforms and have them grow, even without having people like or follow our tweets as we put them forward. So as I conclude, I just want to inform the team here that we have an upcoming event that will be on 17th, and that's this Thursday. It will be a prayer breakfast and of course an annual get together. We always get dinners, but this time, of course, due to the restrictions and all that, we can't have the dinners. So we'll have a day of prayer, and we invite you all to join us. You can join us online and pray with us. And that's the link for registration. In case you need more information about it, you can reach out to us and we will be able to give you more information. Thank you, Wezerai and the team, and of course to Lacey and Cindy and the team at CHC. We really appreciate the support. And yeah, like I said at first, you're part of the reasons as to why our presence has really improved. So thank you so much.
Thank you, Zaitun. Don't stop sharing your screen, please.
Oh.
Yeah, that's okay. Listen, the prayer breakfast is a great example of moving online, but something that you normally do in person. So we will share that as an email as well. And perhaps others on this call can attend the breakfast, not only to pray and support you, but also to learn how you do that.
Sure.
So it feels a bit terrible, but we're not going to open up for too many questions unless there is a burning question, because we really have run out of time. There were so many great comments from our presenters. What I would really like to just emphasize is the points that were made are many good ones. We will share the presentations. We will share the templates so that you can begin moving forward on some of these. And as several of the presenters said, don't be afraid. And Zaitun made that last point very well. Don't be afraid to just get started and go ahead and start. And so you can begin thinking about your audience, as Cindy advised us. Get started, maybe just Facebook. Just focus on Facebook. Get started with a few more things there. Don't be afraid during this time to keep moving forward. And Global Partners in Care and APCA are committed to continuing trying to provide some strategic support for communications for you. So we will follow up with emails. We will follow up in the new year with some additional webinars, and we will seek your input on what will be most helpful for you. And I would just like to turn it over to Dr. Emmanuel for a brief closing. And thank you very much to all of you for spending your time with us today. Dr. Emmanuel?
Thank you very much, Lacey, and thank you very much, everybody. Special thanks to Pikau, Zaitun, and your team, as well as HOSPAS. We also want to thank Wezerai on our side for keeping us in touch and awake, and keeping us busy with the comms side of things. We thank Global Partners and all your partners in the US for supporting us and keeping us afloat. We realized, as Zaitun and Eunice said, we have a big challenge of helping the hospices and our other service providers to also maintain a strong online presence. I think, and I hope that that will be our next discussion as to how we can support the national associations to support the hospices, establish a strong online presence. Thank you very much. Thank you, the team at APCA, and everybody who has joined the call. May God bless you and have a fantastic Christmas and a Happy New Year. Thank you.
Thank you.
Thank you very much, Dr. Emmanuel. And thank you all for joining. I will keep the meeting open for just a few moments in case anyone has a quick question or two. A few of us can go on to answer those.